Welcome back. Now, winter can be a tough enough part of the year for everyone, but for people with respiratory illnesses such as asthma and COPD, it can be particularly a tough time.
Yes, here to talk about the particular challenges they face are Nicky Coles, who lives with COPD, and Dr. Dermot Nolan. Good morning to you both.
Morning, gentlemen.
And thank you for joining us. Nicky, you're going to take us through your experience of COPD, because like many people, you didn't realise you had it, first of all, but there was kind of a series of chest infections that you were battling.
Yeah, I would have been getting chest infections for, I don't know how many, very, very long time. And but I just thought it was part of the normal run of things. I had been a smoker. I stopped smoking probably about the turn of the century. And the most recent century.
I'm glad you clarified.
So look, it was part of the normal course of things. I just got over them. But gradually they just were getting worse and worse. And then I was having difficulty breathing.
Right.
I mean, that's serious
Just on
stuff.
a normal day-to-day basis?
No, when I got a lung infection, or a chest infection I would refer to it at the time, I was also having difficulty breathing.
Right.
And I'd gone to my doctor, and I can't quite remember the course of events, but I know that COPD was mentioned, and I had no idea what the guy was talking about. And it was only then I became aware of chronic obstructive pulmonary disease and all the misery that goes with it.
So it was a whole new concept for you to deal with?
Yeah. And it meant that you've got to take like antibiotics and sometimes steroids, which are not particularly pleasant. And that's it. But in time then, I had a particularly bad year, and where I was in hospital a couple of times with it, because it would get so bad. It got so bad on one occasion. This particularly dramatic one for me was I came down one morning from bed, sort of in pyjamas, and I feeling very unwell. I'm trying to decide what I'm going to do. I'm going to go to the doctor. Well, I possibly should have gone to the hospital. Didn't know what to do. And then I got to the doctor, and then I realised I wouldn't be able to get back upstairs.
Wow.
My breathing was so bad that I just couldn't make it upstairs. And I had to dress in the kitchen. I had to shave over the kitchen sink. And then got down to the doctor, and I was immediately sent to the hospital. But that's how bad it can get.
Of course. I suppose the worst part is not knowing what it is. Once it's diagnosed and you can manage it.
Yeah, I mean, once I got over the infection, but you've got, look, your lungs are congested, you've got to cough up. And you can't cough it up if it's really bad. That's where the steroids come into it. They open up the passageways, allow you to breathe. And the infection will go, and then in time you can cough up the residue of mucus that's in the lungs.
Dermot, we might bring you in here. Is it a fairly typical story we're hearing here about COPD and how we discover it ourselves that we have it, a series of chest infections, etc.?
Yeah, I think Nicky's story is very typical of that's exactly it. So typically over 40 years of age, smokers or ex-smokers, and presented with this often a sort of recurrent chest infection, shortness of breath. And we talk about this the iceberg phenomenon in COPD, where we've 100,000 patients with COPD in Ireland, but there's about 200,000 patients out in the community who not even aware that they have it. Wow. So and they often just think that they're getting infections after infection, but not really. It's not really twigging. They may not even be presenting, or maybe just dealing with this themselves at home. So,
but how would a doctor, if you're going to visit your GP and you have regular chest infections, is that a flag for your doctor? Does your doctor say, well, look, we need to get this looked at now properly?
I think that's exactly what has to happen. And I think there is diagnostic tests, like the spirometry tests and lung function testing, which is really accurate at diagnosing it. But I think it's getting it out there to the community, the people, that it's not normal to be coughing every day, to be getting recurrent infections, that something needs to be done. And we have better treatments, and as you know, Nicky's is a good point and example. The thing will improve if you can get the right treatment.
Are there any other symptoms that viewers should be looking out for, Dermot, just before we go through your checklist of staying healthy? Just a trigger.
It's this chronic cough, recurrent infections, and sort of often purulent, or coughing up green phlegm, or this type of thing, multiple infections, and that shortness of breath, and just feeling unwell, just not feeling, you're not getting 100% of your oxygen into your lungs, so you just feel tired and miserable with it.
And are asthmatics more prevalent, Stuart?
Well, it's asthma is a sort of a different condition. Asthma tends to be the younger age group, not typically smokers. So there's sort of two, but there is a sort of about 10% of patients will have the two conditions, what we call the overlap. They'll have COPD and they'll have asthma. But asthma is sort of the younger age group, not often with other things such as maybe allergies or hay fever or eczema, etc. That cohort tends to be more the asthmatic, where the COPD is sort of the older group.
Okay. We have a checklist here, just a list of advice, I suppose, in terms of measures you can take. Does this apply, before we go through it, to anyone with asthma or any kind of lung disorder, Dermot?
I think it's any type of lung disorder.
Okay.
And again, we'll go through some of the stuff, but again, there's particularly with the COPD, there's the three key things we say to them: get active, get vaccinated, and quit smoking. Those are the three things, and we'll talk about those in a few minutes. But
they're pretty basic, aren't they?
They're the sort of things we really need to bang home to the community.
Okay.
The first one you have at the top of the list is the flu vaccination.
Yeah.
And it's key to get that done if you have a lung disorder.
You're absolutely right, Simon. And we're just starting. Flu's hitting us at different times. It used to be typically maybe around Christmas time, but this year it's a little bit later, and we're starting to see it starting to rise up. So I expect the flu is going to hit us a little bit harder in the next couple of weeks. So it's not too late to get it. It's really, really important. It does give you protection. A couple of myths out there: it doesn't give you the flu, and I think it's important that
it won't make you sick.
And it doesn't really make you sick, but it does give you offer protection. And along with the flu vaccine, which can be got from your GP or your pharmacy, the other really important one for patients, particularly with COPD, is getting the pneumonia vaccine, the pneumococcal vaccine, which can be a killer for patients with COPD.
I wasn't even aware that there was a second vaccine.
Neither was I, actually. So you can just volunteer to have this done.
This is done free of charge, if you're in your GP, and you get it every 5 years. You don't ever get it every year, and if you're over 65, you only need one vaccine of it ever. Will cover you for your lifetime.
Right.
But it's really, really important that patients get that.
And then you have some kind of general, I suppose you describe them as housekeeping kind of thing, like washing your hands regularly, so you're not if you come in contact with somebody who's not well.
Yeah, I think that's it. Particularly the elderly, maybe your grandparents and stuff like that, trying to risk avoid as much as you can. So if the grandkids have got dying with colds, they don't they keep away for while they're infective as much as possible. The winters seems to go on longer. We seem to be getting these milder, longer winters, but yet you never know when we're going to get hit with it. So like last year around this time, a little bit later when we had the snow hit, etc. Like that. So it's important that people look after themselves when they're going out, wrapped up, keep warm. Elderly with COPD, it's important that their houses are
kept... is warm,
Yeah, and then often there's still a aversion of turning on the heat and don't want to waste heat and all that sort of stuff.
Can I ask you, as an asthmatic, because we were talking before we came on air, just about inhaler use, because a huge amount of asthmatics, we're not using the inhalers properly.
Yeah, you're absolutely right. And I think the vast majority of patients aren't using it properly. And again, it takes a little bit of time to show people how to use inhalers properly. And again, the medical service is under pressure. And I think we're lucky to have really good resources in asthma.ie and COPD.ie websites. And there's videos on those to show you exactly how to use them. But patients aren't using it incorrectly. And
it's actually interesting because one of my kids was diagnosed with asthma, and I was trying to show him how to use an inhaler. And then I was thinking to myself, am I using it the right way myself? And I went onto that very website to look at that, and I was able to show
the right way.
Nicky, how's your health now? How are you coping with your condition now?
Very well.
Are the winters tough?
Yeah. Well, this winter, touch wood, is
good.
Very good. But the difference is that I did a pulmonary rehabilitation course.
Oh, right.
And did that in Tala Hospital. It's a fitness course, and it improved my physical fitness. I'm not going to be competing in the Olympics or anything like that, but I'm a lot better than I was. I know.
Snooker into the Olympics. You never know.
but I'm in a lot better shape than I was.
Good.
And then a crucially important thing is that around that time we set up a COPD support group in Tala, and we do exercises every Thursday morning. We've a professional fitness instructor comes out to us, so we're able to maintain. It's possible to maintain a level of fitness. That's crucial.
That's
And
so
that's all, as you
absolutely
say,
crucial.
Dermot, that's all key as well.
Because look, it's a kind of thing. It's a kind of condition. It's kind of counterintuitive. If you're not well, you don't want to be doing things. But the more you move around, the more you can clear your lungs.
The better you feel.
Yeah, and I mean, I feel a lot better now. I can walk longer distance. I actually enjoy walking.
Good.
Brilliant, and you feel so much better afterwards. Well, thank you for coming on.
Thanks for sharing your
talking
story
to
with
us.
us, Nicky.
And thank you, Dermot, as always. Great advice.
Thank you, gents.
Now, after the break, Styles, if you've a communion in your house this year, join us at the Catwalk next.